Welcome to the MedCoShare podcast, the podcast where we learn everything about what it's like to be a private practice healthcare practitioner in today's world. We dig deep into the challenges of being a healthcare practitioner, but also the rewarding aspects that the work entails. My name is Ronak Vyas, and I'm the CEO and co-founder of MedCoShare. I'm excited to announce that on our very first episode of this podcast, we have one of our very first members, Marybell Rodriguez of Blissful Aesthetics. She joined over 3 years ago and is still an active member. Marybell, it feels like yesterday that you toured our first location in Philly. I was excited to do the tour and I had an entire sales pitch ready, but you took me by surprise when after 5 minutes you said yes and you were ready to join. So tell me a little bit more about yourself and what made you become an NP.
Hi, Ronak. Thank you for having me on today. Yeah, it just feels like yesterday that I first walked into your facility and kind of joined the MedCoShare. I'm a nurse practitioner. Actually, this year makes 10 years practicing as an NP and kind of for 3 to 4 years venturing off on my own. I have an extensive background in vascular surgery, cardiology, endovascular medicine, and also aesthetic medicine. Blissful Aesthetic came to life in 2020, you know, how we all went through this pandemic, but I'm still here. I'm still here and excited to see where we go from here now.
Yeah, no, that's amazing. What was your experience like before joining MedCoShare?
So my experience is straight hardcore working in the hospital for, the past 5 to 10 years. It's just a different structure. Being an independent practitioner and having my own practice does give you that autonomy that, you went to school to study for. And being around other like-minded providers and professionals does give you that sense of comfort. And also your patient rapport is a little more, intimate than in a hospital setting where it's like a fast-paced in and out. So yeah, MedCoShare has sort of made one of my dreams come true.
No, that's awesome. You definitely took a risk with us, and we really appreciate it. The first year was really strange because of COVID. A majority of the office was empty, and it was just me and you sometimes and, one other person. And then we were interviewed by the Philly Inquirer, and that gave us good exposure and, that we all definitely needed. But after the story went live, something interesting happened to you.
Yeah. So I guess the Philly Inquirer is read all around different states as well. And the Philly Inquirer somehow hit I guess a prison system. I think it was in Fort Lauderdale, Florida. And then I did get a letter mailed to me to MedCoShare for Blissful and Marybell about someone, I guess it was an inmate, who read the article and was very impressed that I was a native from Philadelphia, and he was very excited for me. He was a complete stranger, and yeah, he was like very interested, I guess, in me and my business. But we kind of chuckled at that because we couldn't believe that it met, the media went that far, and we, people were that interested.
Yeah, no, I remember you telling me the story, and that was definitely pretty unique. So going back to Blissful, can you tell us a little bit about the services that you provide? Yeah,
so it's a aesthetics and wellness center. So we do provide services such as skincare, microneedling, Botox filler. We also do the wellness as the vitamin therapies, whether it's an IV injection or IV infusion. I'm a real into health, wellness, mind, body, and soul as well. I'm also a Reiki certified, so I do incorporate meditation, mindful meditation, as well in some of the IV hydration sessions, just to give you a more calm, soothing experience.
And what are some of the challenges you faced after launching your business?
So one of the main challenges for me was, like I said, when I started my aesthetic business, I have tons of training and so forth. So it was just gaining that patient exposure and that commitment of patients to come to me. So the marketing was a little strange because we were in the middle of a pandemic, and, you couldn't really market face value. It was kind of word of mouth, but my reputation means a lot to me. So obviously I had a good reputation that people were inclined to send patients to me. So I was able to generate clientele through that way. But it was a little challenging in the beginning to try to get patients because no one was kind of marketing or doing any networking at that time.
Yeah, marketing is typically a challenge, for private practices, and that's one of the reasons why we launched MCS Services.
Yes.
So we did a survey of what's the docs and the nurses' pain points when they start a business. One of them being staffing, and the other one, marketing, is a big one. And especially in the Philadelphia region, you're not just competing with other docs, you're competing with major
Right.
healthcare systems. So marketing is really, really important. What advice would you give to other NPs entering the beauty business?
I would definitely say do your research on the main thing for me. If you have your skill. But at the same time, you want to make sure that you are at like a good location, because you want your patients to feel safe. You want your patients to feel comfortable, and you want them in a good space as well. Because I think when you're in a good environment, either it's lighting, coloring of the facility, and just the energy, you want to make sure that it's a place that, can work with you. And somewhere such as MedCoShare is exceptional because as a starting provider, you don't know which way business can go. Businesses, they do go up and down, and the way the memberships are set up, that, if you're having a bad couple months, it's just a conversation you can have and, downgrade your plan to something that's more suitable for you and your business, and you don't have to just close shop completely. And the other thing is that with the other providers in that facility, you can also network and try to grow your practice as well. And don't be afraid to reach out to other practitioners who are in practice, even if they do consulting or offer services to kind of help you gear on, because it's not a one-man show. And that's what I learned. It takes a village, and I feel like the support from MedCoShare and even other providers that I met along the way had led me here to be practicing, 4 years from the day I started.
No, we're definitely happy to hear that, and thank you for that. So what's your long-term vision? What are your long-term goals?
So my long-term goals is to open Blissful up in every MedCoShare location, to have a full running staff, and just continue to add additional services. Like I said, we've been going on for 4 years. It's just been a one-man show. The provider's just been me. And my clients, I even do surveys asking, how would you feel if I bring another nurse on? And they're like, no, we just want you. But, it has to grow. And right. I will make sure that, when I screen the next practitioner or nurse, that they will provide that adequate and, care with compassion, empathy. It just has to be another me. But I'll make sure that happens. But that's just a long-term goal, and I can see it coming to life soon.
Yeah, no, we definitely want to support you in every way we can. Marybell, thank you so much for your time, and thank you to our listeners. If you want to hear more of these conversations, as we dig deep into the lives of our members, please follow us on Spotify, Apple Music, or wherever you get your podcasts. Follow us on social media to hear more from our doctors and nurses, as well to keep updated on all things MedCoShare. We hope you'll join us on the next one. Until then, don't forget to practice your way.